Good evening. I hope everyone's been enjoying our Healthy Kids Summit today. It has been a lots of amazing information. We've covered the eyes, we've covered the teeth, we've covered immunizations and vaccinations. And in case you hadn't noticed, we're in the middle of a pandemic or towards the end of one and start of a new one or whatever. So, immunizations and vaccinations are very important, not to mention people are going back to school. So, all the more reason. So, if you could please, I need to remind everyone to please share the broadcast because somebody needs this information. Because tonight we are talking about it takes a village creating a health team for your child. And I hope that you adults are watching us on blackdoctor.org to know that it takes a village for your health team as well. But tonight we're talking about kids. So being a parent is sometimes described as a full-time job between school, homework, and extracurricular activities. That's enough to keep any parent occupied. But what about their health? Parents have to be the doctor, nutritionist, dentist, etc. for their children. And sometimes it can be overwhelming and still not enough. Tonight, we are here to give parents the blueprint to creating a health team for their children. We have pediatricians, mental health, and healthy eating experts to help you build a winning team for your child today and the future. So, my guest today, in case you didn't know, I'm Dr. Renee. And you probably see me a lot of times on Black Doctor. But my guests today are Dr. Michael Lenore, pediatrician, asthma and allergy specialist, founder of the African American Wellness Project. Dr. Kimberly Matthews, pediatrician and chief medical officer at Next Level Market Career Consulting. Dr. Erica Goodwin, double board certified psychiatrist and host of the Better with Dr. Erica podcast. And Dr. Nina Cherry Franklin, nutritionist, exercise physiologist, and known as that salad lady online and social media. Welcome, everyone, and thank you. I am so excited. So let's jump in. In my opening summary, I mentioned that parents are juggling a lot when it comes to their children. In your experience dealing with parents, did you find they seemed overwhelmed with all they had to manage with their kids? We'll start with you, Dr. Matthews.
Yeah, so absolutely. Thank you for having me, everybody. I'm happy to be here this evening. So parents are definitely overwhelmed. Right now, we're going through a pandemic, like you mentioned. And so having to juggle, work for them, whether they be remote or if they're working back in the office or wherever they may be, and also having to juggle, their children's health, that's been a major issue. We basically, like you mentioned, try to have a whole care team involved so that we can help them with any sort of, issues that they're, dealing with. And, like you said, it takes a village. So that's basically, our role.
Were there areas that they seemed to focus on more than others?
That's a good question. So I would say, counseling, has been an issue with them not being able to sometimes get all the resources that they need. Some of our patients need speech therapy and occupational therapy, physical therapy, and those things with the pandemic, have basically been unavailable to them or some sort of remote option. So that has been a major issue, receiving those services for a lot of our parents, for sure.
Definitely, definitely. As you know, many adults tend to look at their health in separate silos. So when we become parents, we pass the way that we handle our health on to our children. So, what impact does having a disconnected view of health and wellness have on parents' ability to improve child's overall health and well being? What do you think, Dr. Erica?
Pardon me, I feel like I'm slow on the unmute, and thanks for having me. I'm really excited to be here. It can have, I would put it into kind of three different silos of how all of this can impact people. Is number one, naturally, when parents come to see me, this isn't number one, this is the side to number one, is that most people don't want to actually show up in my office, even though I'm very pleasant. The average person does not want to have to see a psychiatrist for their young person. So usually by the nature of them being overwhelmed, they're overwhelmed just by the fact they were there. There are kind of three different ways this kind of difficulty with organizing all of this healthcare ends up affecting people. Number one is that people end up not getting help and thinking they should do this on their own and end up overwhelmed, trying to fix problems or manage things that they actually weren't trained to do. Number two is that this can also affect development by those delays causing issues that are behavioral or even with communication oftentimes. So when there are delays for children getting some of the holistic care that they need, because there are lots of things that go on with young people, is that if they're not feeling well, then you all have seen it. Kids that don't feel well, typically they'll either withdraw, they could be grumpy, they can be irritable, they can start having social issues because they're not getting along with people. They don't necessarily always have the language to tell what's wrong. And they may start acting out because they're not feeling well. The third way is something that the other physician also mentioned, is that by having some disorganization or some difficulties, that sometimes there's a delay in getting to the right person. And for a lot of the different specialties that work with young people, that delay can mean a couple of different things. One is that delay may mean that there are already waiting lists for a lot of different types of mental health professionals. I know you mentioned physical therapy, OT, speech therapy, but just almost any kind of specialist that you need. There were delays in access even before COVID, but especially in a lot of fields that access is even less. The waiting lists are drawn out and people may just be full and not have availability. So having delays in seeking care can then be further impacted by wait list or that care not being available. And then there are certain types of interventions, and some of them are really big when it comes to mental health, when it comes to being able to get testing covered, to have access to the appropriate type of testing. And there are certain types of therapies like ABA therapy, or things that you would use for autism, that not only are more effective when kids are younger, just the amount of resources totally shift when people turn 18 and switch out of child to adult services. So it's really important to have that support to be able to access the care you need, because it's going to not only make your child's life better, but yours also.
Thank you so much. It's awful that the whole pandemic happened anyway, but it made it worse because, of course, people were afraid to go to the doctors, and so not only were you afraid to go as an adult, but you didn't want to take your child because you were afraid they were going to get sick at the hospital or at the clinic. So yeah, unfortunately, a lot of children kind of missed out on some things that they probably could have been picked up on a lot earlier. So Dr. Lenore, can you provide some examples in your work with asthma patients where the parents over-focused on one aspect of their health at the expense of another?
In my experience, parents are pretty well prepared for sickness, but not for wellness. That means that they know who to call, where to go, and what to do when the child is sick. But so often there's so many other dynamics that take place in trying to get a child to school that often they forget about diet, about exercise, about all the other things that keep children well. But I do find that most of the time when they're overwhelmed, it's really around the wellness issues rather than around the sickness issues. They usually know who to call and when to call and where to go. But keeping the child healthy because of diet and exercise and some of the other dynamics that go along with living in a pandemic, I think seems to be one of the bigger things. Asthma is a chronic problem, and chronic problems tend to become less acute in the face of other priorities. And so consequently, what we see is a lot of parents having to deal with children in crisis when if they dealt with them, especially with a chronic disease like asthma early on, they would have not had to deal with so many ups and downs with a particular problem like that. So wellness is where I see most parents having difficulty once their children start to go to school.
Yeah, and in the Black community, of course, asthma is so prevalent, but then so underdiagnosed. I think a lot of times people don't see the right doctor, so then they're treating symptoms instead of treating the actual condition, and that's where you get all of these absences, and children become, delinquent because they weren't there when they should have been in school. So I think an allergist, if you have a child that has any symptoms, and we'll talk about those later, Dr. Lenore, but symptoms, then you need to see an allergist and get that on board on your team immediately.
And I would say, just to give credit to other doctors, you just need to find somebody who knows what they're doing. It can be a primary care doc, it can be a family practice doc, it can be a good nurse practitioner or a physician's assistant. But you got to get somebody who knows what they're doing.
Definitely. So, Dr. Erica, what are implications of parental disorganization regarding their child's health and health and wellness on the child's development?
Well, just when it's difficult to access the appropriate resources when you're disorganized and overwhelmed, which I believe everyone has experienced probably in some facet during the pandemic. And this is complicated by the fact that there are some areas of health that are easy to access or easy to find. So it's not a huge mystery of how to find a pediatrician. It's not a huge mystery how to find urgent care or the emergency room. But a lot of times it will take a higher level of organization to find a lot of these different other kinds of specialists. Even something as simple as you mentioned an allergist, but I'll swing back to mental health, but finding a child psychiatrist or a child and adolescent psychologist, someone that actually does testing, to a lot of different types of specialists or services is more difficult. So if you're not organized, it's hard to do that. And also that organization can get in the way by not being able to communicate what you need to do to whoever you are working with. Because I'm sure everyone out there has seen it. When you see the doctor or you see the therapist or you're even talking to the nurse, you don't have 2 hours to sit there and tell them everything. So if you're not organized with the information and organized in a way that you remember what you need to convey, someone may not have all the best information to make the best decisions. And as we talked about earlier and everyone has alluded to, is that children that are struggling from a mental health or physical health standpoint, that also can bleed into their social development, their ability to communicate with others, their ability to engage in school and other activities, the way they communicate and engage in their family. And all of those things help to develop a well-rounded young person that can communicate effectively and learn effectively. And the other piece with that, which Dr. Renee and Dr. Lenore alluded to, is that sick kids miss school. When you miss school, with that being the main job of a young person, you get behind. When you get behind, that can lead to kids being sad or dysphoric, or they can get irritable or frustrated because they're behind and they can't figure out what's going on. And we don't want any of our kids in that situation.
Definitely. Dr. Nina, when parents come to you about helping their child develop better nutrition habits, do they mention any of the other professionals their child may be seeing?
Now, that's a very interesting question, and thank you for having me. This was an excellent segue into me because literally everything that the other doctors have spoken about, it all trickles down to two circumstances. I'll say the third one a little later. It's three, actually. The first one is emotional eating. And that ends up leading to kids becoming more overweight, and actually to the point now that kids are developing diseases that were originally considered adult diseases. You also have a sedentary lifestyle, which is tied into that. I mean, the first thing, as Dr. Erica mentioned, is that when the kids start to withdraw, oftentimes that happens from a physical activity perspective as well. So the kids are less active, they're emotionally eating. And the third, which I'll sneak in here, is parenting as well. When parents are overwhelmed, they tend to do the same thing. So what we end up losing is that role modeling aspect. So oftentimes, especially due to emotional eating and having struggled with emotional eating myself as a child, this is one thing that it's out of the hands of the coach, me being a healthy living coach at a certain point. And I've actually had to refer children out to see psychologists in order to address the emotional eating that occurs. And all of this is tied into psychology first. If we cannot understand what's happening from a mental perspective with the children, there's really nothing you can do from an eating perspective or really getting them to move more. All I can do is send them to the right place and hope that the parents follow through and they end up getting help in that aspect. And I have found that I've been doing that a whole lot more with the pandemic.
Wow, that is interesting. So parents, when you see parents, they are probably at their wits' end, but who's referring you patients to you?
You know what? I get it from generally, I'll tell you the average thing that happens with me. I get frustrated parents first.
Okay.
And unfortunately, there's a disconnect in our medical system. And I will say this coming from the standpoint, I'm an exercise scientist and a nutrition scientist in rehabilitation as well. And the disconnect is when it comes to wellness, as Dr. Lenore mentioned, there's really not a lot of, the best way to put it is coding when it comes to wellness, especially when it comes to children who quote unquote have nothing wrong. So, we'll get a child who is severely overweight or a child who may have developed diabetes, type 2 diabetes. But when a child is leaning somewhere, there's really nowhere to go. So generally, I get parents who have no clue what to do. All they were told is, for lack of a better word, they were told their kids are too big, and they need to exercise and lose weight and do something. The parents come to me with the same goals themselves. So they really don't necessarily know what to do for their children. And honestly, I am generally given permission to take over that. And that's what the parents do. It's kind of almost like a release. Can you just take my child and fix them? Because the medical system is really not helping them. And I don't know what else to do.
Wow. Dr. Matthews, what is the biggest challenge you face as a pediatrician when it comes to parents and handling of their kids' health?
Right. So, oh my gosh, there's so many challenges, unfortunately. But I would say a lot of it is misinformation. We're living in an internet generation right now, right? It's a new era where the internet is easily accessible to all of us. And so I get a lot of parents that have seen things on TikTok or Instagram. They've searched Dr. Google, as we sometimes, call it. And they, basically presenting these things as factual to us. And so it's a little bit challenging. It's a bit frustrating sometimes to have to debunk these myths. But, I always create a safe space where they can come with any questions that they have. They can call me. And we can always provide resources and education for them. But, parents are just trying to do their best. So if you can easily go online and check for something for an issue that your child may have in the moment, I don't blame them for that, but I just always, try to encourage them to seek other resources as well.
Yeah, and make sure that you're getting, because there are a ton of physicians on TikTok that are giving factual information, but you have to know that you're getting it from the right person, because of course, as it said on the screen, misinformation is a public health emergency. We saw that in the pandemic, and that's why Black Doctor did so many stories about COVID, because it was so much misinformation that was all over the internet. And, not only the parents were reading this, but the kids too. So, you had children that were afraid to even go back to school and, and be in classrooms because of what they read online. So, information is key. And I can only imagine, the parents and, all that's happened and all that's happening. And now we got monkeypox. Oh my God, what do I have to do? Does Johnny need this vaccination? And, because he'll be in close quarters with other students. And I can only imagine. So if they don't, how do you help them develop the health network integration to improve the results they have with you? And anyone can take this one. Dr. Lenore, you're on mute.
I think the first thing you have to do is you have to make each visit as a pediatrician a learning experience. You can't just simply deal with the problem that's in front of you. I think that if you you've got the child in front of you, the family in front of you, most solutions are family-based solutions for problems that children have in terms of nutrition. I often tell parents who are worried about their children's diet, a child can't drive to McDonald's, but you see a bunch of children in there, and your children are in there as well. And so consequently, all of a sudden, you expect them to develop good eating habits. So we try to take a little bit, and we don't overwhelm them, but we try to make each visit kind of a learning experience. Some of it's shared anecdotal experiences, some of it is book learning. But I think that if you don't take that, so these most of the time, we spend a lot of time as pediatricians, as I'm sure Dr. McKenzie will tell you, doing these unnecessary school physicals. We see them and we find virtually nothing, but that's a good opportunity though, to sit down and see what's going on in the family and interject your experience or some of the things that you want to impart to that family. So I think that's how you do it. And gradually, over time, that builds trust, it builds experience, and I think you get a much more informed parent if you take that attitude from the time they're little babies in your arms until the time they go to college.
I have I have three quick things. The first one is one thing we have in a lot of our offices, and they have it in some primary care and specialist offices, are case managers. So they can be a wealth of knowledge of how to connect you with different resources, especially if you're having some difficulties. The second thing I would think of to tell you is if you could make a wish list of all the things you want help with for your young person, and then you take it to the doctor or the expert and ask, who is the person that does this? Because sometimes in the community, you may not know what specialty or what person does what, but a lot of us, if we don't know, we can find someone that does. So if you tell us what you're looking for or what you feel like some of your needs or goals are, we can help point you to the right person. And the third thing is, I'd say, don't be afraid to ask questions. And if the people in your healthcare team or that you're working with aren't receptive to you asking questions, they may not be the best fit for you. But, I think a lot of it is around being inquisitive and asking those questions and asking how to get to the resources and being open to having a team that's more than one person. Because a lot of people, kids and adults I know with wellness teams, it's not just their primary care doctor.
Thank you. That very helpful. Does anyone else have anything to add?
I just wanted to add, just to piggyback on Dr. Lenore and Dr. Goodwin, I agree. The organization is, top. You basically need that overall, but you also need to advocate, like Dr. Goodwin was saying, for your child. Right? So you have a child that is leaning more on the obese side, instead of waiting another year, where they could potentially gain, another 10, 15 pounds. 3 months. Let's do a 3-month check-in. That's what I love to do. But as a parent, it's good to feel empowered to just advocate for your child and say, can I come in another 3 months so we can do a weight check? And so again, we're checking their weight, we're making sure we're checking in with each other, and we're having a discussion so that we don't wait, another 12 months for any issues at your well visit.
That's a good idea, because a lot can change in a year, and it can be very damaging, a year, and next thing you know, now they have type 2 diabetes when they come back next year. So it's definitely a good idea to do, incremental visits so that you can make sure that everything is going the way it's supposed to go. If they're working with Dr. Franklin, make sure everything is going in the right direction.
Yeah.
Go ahead.
I want to add to that too, because one of the issues when it comes to eating, nutrition in particular, is we have to eat. And it's not something where you can say stop eating, or you know what I mean? So it's one of the biggest challenges, and I cannot emphasize this enough, is I always I feel for physicians a lot, because you only have so much time, right? You only have so much time to really talk to the child. And a lot of physicians are not well versed in nutrition, kind of the classic textbook things, but there are some out of box tactics that you implement. Now, I'm coming from a research background, fitness background, and healthy living coaching now. And coaching is so much different. And I'm sure as a psychiatrist, Dr. Erica knows this, it's different because coaching is more of an empowerment thing. So it's less prescriptive, and it's more, let's figure out ways for you to do X, Y, and Z. So the notion of finding a team is it is the idea behind coaching. But one of the main things, and I cannot emphasize this enough, Dr. Lenore said, I've heard you say this before about McDonald's. This has to be a family thing, because I can do everything possible to help a child. The pediatrician can talk until they're blue in the face. But if that parent has their own inherent biases and skepticism, you're not getting anywhere with that child. And I know this personally, even from dealing with severely morbidly obese children. I had a client, for instance, that was over 400 pounds. Yes, this is an adolescent. And one of the limiting factors, one of the things that kind of was like a barrier for us, is that her mother literally, help her, but don't help her too much. Do this, but don't do this too much. Because what ended up happening, and she did drop 50 pounds, might I add, in a very short amount of time working with me, but she basically had to take over the nutrition angle in her own household as a 14-year-old. And so that's a huge limitation from my end when it comes to nutrition. So modeling is a big thing. Now, I empathize and I sympathize because I realize that parents are overwhelmed. And this is just another layer of something that parents have to deal with. But the beautiful thing about nutrition and wellness in general is that this is something that the whole family can benefit from. This is not just a child thing. So every skill that that child picks up, or every skill that that parent picks up for that child, it is a skill that can work for everyone in the entire family.
That's true. And you have to. This is the parents need to be the parents and help out. And if that means that I can't have McDonald's, then because she can't, well, then that's just the way it's going to have to be. But you have to model the behavior to help the child to get to the goals that they need to get to. So let's talk more about solutions. First, what are the services and providers that all parents should have for their children?
I think that first of all, you have to have a primary care physician. And I think there's some structural things that parents can do. One is select your pediatrician or select the doctor that cares for your child. Don't let someone assign you a doctor, doesn't want to talk to you, that doesn't want to spend time, gets mad when you want explanations. Then you have to organize your visits. You have to decide what you want to get out of a visit. Maybe write some things down so that you can ask questions, and then insist on answers. I think too often, primary care physicians or specialists of various types don't like for you to ask questions. But when you have a question, ask that question and understand what the outcomes are. Don't leave that office not knowing what the medicines will do or what they're for, or don't leave the office knowing when your next visit is. And then finally, you need an advocate sometimes to go with you. Now, most of the time, those of us pediatrician, I'm sure Dr. Matthews McKenzie will understand, we're dealing with the grandmother. You can talk about all the things you want, but if you don't include that grandmother in the discussions around the health of these children, I'm telling you, you just, all you're doing is setting yourself up for failure, because a grandmother can destroy everything you've said in less than 2 or 3 minutes by just saying, honey, we never did that.
But that is so true. And we stress this all the time. If the doctor is not listening to you, or you don't understand what's coming out of the doctor's mouth, you should probably find a different doctor. And these health management organizations and all the insurance, there's so many choices and options. You don't have to stick with that one because that's the one they assign to you. Like Dr. Lenore said, you need to find somebody who's going to actually listen to what you're saying and that you can understand them when they speak to you. If they're speaking to you and you never understand what they're talking about, how are you supposed to be a compliant patient if you don't understand what's coming out their mouths? Erica, what do you think?
Well, you know what I'm about to say. I think a person that can be very essential to a wellness team for a young person and even a grown-up is a mental health professional. We're in unprecedented times where these young people are struggling. And I feel like it puts unfair pressure on you to take that on as something you need to manage all on your own, especially because there are people like me that went to school for literally forever to do this kind of work. Because I'm a subspecialist. I was in school and residency literally forever. And I think a lot of times putting that pressure on to figure that out is just too much. So I do think that can be a really wonderful addition to a health team. And depending on what's going on may depend on what kind of services you were to choose. And we don't have time for me. I could use this whole hour on talking about all the different kinds of mental health services. But I do think a mental health professional is great. I also think if there are any questions that need clarity, not just from emotional issues, but anything that's coming up with learning or school performance or things like that, it may be useful to also have someone on your team that actually does true testing, that does either psychological or neuropsychological testing. Because one of the things we often see is that when kids are struggling and they're having difficulty learning or processing information, then it's going to show up in other ways. But someone could give people a million years worth of work, and if there's a learning issue, that's not going to solve it. So I'm a huge fan of that. Those are some people I think that are really essential. But if you ask me the other ones, because I'm not going to hog all this time, I do think it's important if there are challenges to have someone that's actually trained in nutrition, and to actually utilize them and tell them what your limitations are. And that's one of the things I have to tell my patients is if you're on a budget, tell them you're on a budget so they can tell you solutions that are going to work for your budget. Because if you're on a budget, you're not going to go to Whole Foods. But there are Aldi solutions. But you just need to tell people what the restrictions are. If you're the parent and you don't know how to cook, or you don't enjoy cooking, or you hate cooking, or cooking is an issue, then you let them know so they can come up with solutions. So a lot of it is being open and honest with whoever is on your team. But as I said, I think mental health is huge to have on your team.
And I think that, don't you agree that mental health is something that you can be proactive with as well? So, adolescence is a rough time, period, but it's a really rough time in 2022. So, better to get it on board now when the child's turning 13, 14, about to go into high school, than to wait until there's a problem, right?
True. And I'm a big fan of the mental health checkup, which is just as you would go to the primary care doctor and have them check everything out and make sure everything's okay. You can come to one of us and, if everything is good, it's like, hey, you're straight, come back in a year. We'll just make sure everything's okay. Give us a holler if there's something happens. Or at times where it's the same thing I tell adults that these kids may be struggling or just have some challenges or have some things that they're not necessarily comfortable talking to the adults in their life with, that it's useful to have someone to be able to assist them, even if it's not a crisis. And I think this is a great time culturally to start setting a trend where we normalize having mental health support. It's not always because you have a mental illness, but mental health support can just increase your quality of life, your productivity, your happiness, and so many things. And also, I know we've been spending so much time talking about weight, is that also having good mental health can help your weight.
I think the challenge for us, though, is finding mental health professionals. It's very, very difficult. I mean, so
I know we're coming back to that. I think that's one of the reasons why I love having platforms like blackdoctor.org out there, because we were talking about one of those challenges of people finding people for their team, that sometimes people just can't figure out how to find us because, number one, there are not enough of us. But there are a few different places to go to look for mental health professionals, or to have those conversations to identify who is the one for you. But I do realize that we do have a shortage, but I also think there are times when we're underutilized at the same time.
And I think we also, and I'm sure Dr. Matthews McKenzie and Dr. Lenore would agree, we need to make sure that the children see a dentist regularly and also have their vision checked regularly. I don't know, do they still do they used to do dental and vision at school when I was in school. Been out of school a very long time, like many of us.
I know they have it as an option with my children, and
Okay.
and I mean, it's an option basically for the children who may not have the coverage or whatever. They bring people in a certain time of year for it. So I
Okay.
know that at least that's what they're doing in Fulton County in Georgia.
Okay.
And I've worked in many places where the dentist is actually on site. So that's extremely helpful, because if I never been a dentist, it may be, new immigrants from another country, for instance, we're able to send them directly across the hall to dental. So that's extremely helpful as well.
Yeah. So, we're looking at this health team. You need to have a PCP. Your primary care doctor for a child, obviously, is a pediatrician, but then you need to have mental health, dental, vision, and you might need a psychologist if your child's having some learning difficulties, and make sure that they can get tested to figure out what those difficulties are. Because you'd be amazed if you get them tested early enough, figure out what it is. By the time they're in high school, you would never know they had this problem. And we did a show about autism a few months back, and they figured out it was autism early on at 3 years old and got him the help he needed. He went to a bilingual school. He learned Spanish and was speaking English at the same time. And now he's in college and he's actually a comedian. But but that was a great story. And I was just like, most people are like, can't imagine somebody on the spectrum who, doesn't quite react to things in the same way that we do. But you get these, you find out the problem early, treat it, and look what can happen. So, same thing with things like dyslexia and stuff. They can learn that they learn things a little differently, they see things differently, and they don't have to be, some people with dyslexia many years ago, they just called them illiterate. But that wasn't the case. The case was that they didn't see things the same way that everyone else did. So, all that to say that you need to make certain that you do have your checklist. And like Dr. Erica, that is such a good point. Just write down all the things and show the doctor. And I'm sure the doctor can make sure that if there's not a social worker on staff, there's a case manager, somebody there that can make sure you get all the resources and all the referrals that you need so that your child can be great and up to par. And Dr. Leroy, I really did want you to go over what are some of the signs that people might have a child with asthma so that they would know early on.
Well, I think the sign that's most often missed, and probably the most common presenting symptom, is chronic coughing. Coughing with exercise, coughing with laughing, coughing just in the middle of, especially at night. Generally, a chronic cough that's not an asthma type cough usually is self-limiting. Either it's self-limiting because you get sicker, or self-limiting because it stops on its own. But if your child is coughing, regardless of the age, then that's the most common presenting sign. I think you have to look at asthma like you look at other kinds of chronic diagnostic categories. There are different types of asthma.
Mm-hmm.
Generally, children less than 2 who have asthma only with infection can get the sickest. But that's in some ways a good prognosis because they tend to outgrow that pretty quickly. Then there are children who go on to have allergy problems. And then there are children who have periodic asthma with either infection or exercise or under certain circumstances. But I think it's really important, if I have one point to make, is that children who get in trouble from asthma are generally children with mild to moderate disease who get into a situation where they're not prepared and they have no action plan. So if your child has chronic asthma, make sure you work with your primary care doctor, or nurse, or physician assistant, or specialist to develop an action plan for what to do if the problem grows out of your control. I think what's interesting nowadays, we can really manage most children with asthma and keep them out of the hospital if we have your help. That means if we pay attention to the details of avoiding the things that cause the problems, you're understanding the appropriate use of medication and having an action plan. But the most commonly missed symptom of asthma is really not shortness of breath or kids who turn in blue or falling out on the floor. It's that child who coughs all the time or occasionally has very bad episodes that don't last very long because they're the ones that get into trouble the most.
Yeah, and people, you need to know how to breathe. You need to be able to breathe. And so asthma is not something to play with, and people have died and will continue to die if we don't pay attention.
Every day, 10 people in this country die from asthma. African American women have the highest mortality rates. An African American child is 3 times more likely to die from asthma than other children. So and that hasn't changed very much over the last 15 or 20 years. So we have a lot to do and a lot we can do, but there are a lot we should have the opportunity to do.
Now, do you guys think that we can close the healthcare gap by helping parents build this health team and instilling a lasting health and wellness routine early in their lives?
That's a rhetorical question, of course. Of course they can. I think the structural things and everything that's mentioned, certainly to incorporate mental health and dentistry and nutrition into your plan. But I think selecting your primary care physician, understanding what you want to accomplish in visits, taking care of problems before they become insolvable. I think those are 3 principles that I think will get you the kind of healthcare that you need. When you have so many other things to do, having an organized healthcare team really allows you to take care of all I was a single parent of 4 children for about 5 years. So believe me, I didn't have room for another problem. Consequently, if you've got an organized healthcare team, I think that will save you a lot of agony.
Definitely. Dr. Erica?
I think I feel like I'm like the optimistic. I don't want to say, I'll say realist. Because I think it can help, but I think they're going to have to be structural and organizational changes that will continue to help fill the other portion of the gap. Kind of like we can do things to help deal with equity in the workplace, but there's still some things white people got to do. That I feel like there are things we can do to arm parents with as much knowledge and resources and how to go about creating this team and creating access. And that will help close the gap. But then there also has to be a structural or organizational component from how healthcare is provided in this country to make it easier and not so complicated to actually access healthcare, and to also have it accessible no matter how much money you have or how you're insured. Because there are some services, especially for what I do, there are some things you have great access to if you pay cash. Then there are some services actually for children that it's actually better for you to have Medicaid than to actually have private insurance, because they have a larger suite of services available. And I think there has to be something done to make getting healthcare easier. I feel like one part of learning how to advocate and this healthcare team is wonderful, but I do think there has to be some organizational change to fully close the gap.
Definitely.
But the problem is no one's talking about it. And there's no discussion in Washington or anywhere else about changing our healthcare system in any meaningful way. And I think until that happens, it's pretty much every man for himself.
Yeah.
So I participated in a policy paper with a large group of some of the best professionals in the field, and it was published in Mayo Clinic Proceedings in the European Journal, and it was called Healthy Lifestyle Interventions to combat non-communicable diseases. And one of the main premises in there, we basically laid out like an entire perfect world healthcare system. And we're a long way away from that, because the problem is, we saw it a lot with COVID. All of these chronic diseases, these non-communicable diseases that we've been kind of kicking the can with all caught up with us.
Mm-hmm.
So turns out me being overweight, not just the child, but the parent, made COVID worse. Turns out all of these chronic diseases that could have been prevented in the right healthcare paradigm, turns out this caused more death. And it's really that prevention aspect that we just do not acknowledge in a healthcare system. And I work very close. I have a different kind of relationship with my pediatrician. I love her, because instead of kind of being prescriptive with me, and I don't know if she's like this with everyone else, but instead of being prescriptive with me, we have conversations. Oh, that's not going to work. Oh, I think I'm going to go this route. Very much, having a relationship with your pediatrician that way. But once again, if I did not have the background I had, I pity what my children would be going through. And on top of that, you have disconnects in the knowledge of a lot of the healthcare providers. You may have, no offense, Dr. Lenore, but you may have someone who's been practicing medicine for like decades, and they're stuck in the way the science was then. That's why I love Dr. Lenore.
Right.
He's not one of those people.
That's a little bit of me.
Yeah, you may have a little bit of it, but you get it a lot, where it's like, the science has changed like 10 times. Certain things aren't bad. I'll give you a good example. It's a personal example. I actually had a situation where my oldest son, he was very thin. People have overweight being high, and we flag that. This particular pediatrician flagged my son as being too thin for his height. And I, said, what's too thin? I don't get it. And basically, the moral of the story is, she had so many overweight children that her kind of perspective of what's healthy and what's not was skewed. It was totally skewed. And she was from the baby fat generation. And she actually said, my son, who was totally healthy, takes after his grandfather, was too thin, and suggested that I add butter and cheese to his eggs. That was before she knew I was in the field. I hadn't told her that. And he was very young. And so needless to say, that was her last visit. But it's that, and this was a pediatrician, and I could not believe. I looked at, and then I was fearful for every child that she sees that does not have a parent who can advocate that way, and what is happening to these children as a result of that disconnect, and the fact that even if, I'll say it again, they wanted to get help from a licensed dietitian or someone, they can't because nothing is wrong. And likewise with the parent. So it's so disconnected. And the end kind of conclusive statement was, we got a lot of work to do, because there's a lot of stuff, a lot of layers here, and a lot of players here that have to be fixed and changed and tweaked in order for this thing to work. So I'm totally in agreement with you there.
Yeah, my mom fired our pediatrician because I had a severe asthma attack, and she called his clinic and said, Renee is having an attack. My mother is a respiratory therapist, mind you. Renee is having a very bad attack. I can't, reverse it. We need to go to the hospital. No, you can bring her here. So we go to the clinic, and I actually remember I could not breathe. I was struggling. I couldn't sit because I was so uncomfortable. And I remember listening to him asking questions about my sister, my father, and I'm like, but my mom called, so they knew I was coming. My mother, as soon as that lady went in the back with her paperwork, my mother came and got me and put me in the car and said, we're going to the ER. And when we got to the hospital, this is before cell phones, she called my dad and said, we're at the hospital. And so he came up there. We never saw that doctor ever again. My allergist was a Black woman, and she became my pediatrician. And we had conversations, Dr. Franklin. And yes, I was a child, but we had conversations, me and her. I have been a doctor my whole life, according to everyone, because I would have conversations with her about, well, what is this medicine for? And what's this one for? Well, I don't like that one, but I'll take this one. And because of that, I was a compliant patient. And now I don't have to take any meds. My asthma is under great control. And, she was fabulous. May she rest in peace, Dr. Marva Morris. She was amazing. But my mother fired the doctor. And you know what? Because I saw that, I understood as an adult that I could do the same thing. But if children don't realize this, like Dr. Lenore said, just because you're assigned this person doesn't mean you got to stick with them.
Yeah, I think that's one of the problems. It's almost like medical captivity. People are afraid that if they change doctors, or if they don't get the, we always say that if most African Americans got as mad with healthcare that was disrespectful and poor in quality as they do when somebody cuts in front of them at Safeway, we wouldn't have this problem.
You're right. You're right. So anyone have any last words for our Healthy Kids Summit today?
I would like to ask the question of the panel. One of the challenges we have at the African American Wellness Project here in California, where immunizations are actually mandatory, is how to message to young parents about getting their children and infants vaccinated. I've done most of my career has been with messaging, but I'm telling you, I don't even know how to begin this conversation because so many of them are refusing to do anything related to vaccinating their children. And it's not just Black parents, it's parents in general.
Mm-hmm. What do you say, Dr. Matthews McKenzie?
Listen, I am there with you. I practice in New York, and I actually do a lot of travel medicine. So I see, a lot of different clinics and private practices and their style and approaches. I can speak on behalf of a lot of, like Harlem and the Bronx, where I do a lot of my work. There's so much apprehension and fear, especially within our communities, that I have not mastered a proper way to message. And, especially with this COVID vaccine, I think that I let them come with all their questions, and we sort of go through, some of the stats. Well, remember when your abuela passed away and, grandma and grandpa were suffering? I mean, I think you really have to meet them halfway, right? And you may not be, you may not get them vaccinated 100% of the time, but really having honest discussions. Well, what did you hear? And let's talk about those things. But it's a problem that we are all facing, and I'm not sure how we can package it any better. I don't know if anyone else has any for us.
I don't. from my end, a lot of it is going to give you a more compassionate result. Now, whether or not it always ends up with someone getting immunized is something else. But I think one thing is, as Dr. Matthews McKenzie mentioned, it's meeting people where they're at. So it's that taking that big breath before you go in the room, staying grounded with your feet on the floor. People are very perceptive of body language, and being willing to listen with a caring ear to whatever people have to say, no matter how much you disagree with it, and being willing to revisit the conversation. Because I've found I end up having had a lot of these conversations. Ironically, I ended up with people in my practice specifically because they did not want to get vaccinated for COVID, and a lot of the work regulations were shifting. So then they pop up because they were all stressed out because they were unvaccinated. Is these kinds of conversations end up being multiple conversations. It's almost like I look at it like dealing with people with addiction, that it's not going to be one conversation that will get them to wellness. And I feel like the thing in keeping in mind when it comes to immunizations, and I feel like it came to a head with COVID, but especially pediatricians and primary cares that were dealing with young people have been dealing with these immunization issues for years, is just being in a caring, open space, and being willing to listen and accept if someone is not going to get someone immunized in that moment, and be willing to revisit the conversation and to do it with compassion and care.
No, I agree with the same position. I will tell you about a phenomenon in California. It used to be like most allergists, you end up doing a lot of primary care, and I had a full pediatric practice. And we used to talk to parents about immunizations, and they'd have all of these schemes that they wanted to do, and I want to add a little of this, a little of that. And then California made it mandatory. And I can tell you, I have not had one of those conversations since. I mean, it's a phenomenon that just blew me away. Then once they made it mandatory, and you could say, well, they're making me do it, we have very few of those conversations anymore. Now, I'm not for mandates at all. And I agree, you just have to keep talking and understand where the parent is. I just am a little frustrated. And how much information do you need? And that's really where you're thinking, but you don't act like that. And how much more information do you need? But I do think we're going to have a lot of problems trying to get to what they call herd immunity.
Mm-hmm.
I think this virus will be with us for a very long time because of that.
I agree. That's unfortunate.
I think it's also interesting. The irony is that in New York State, of course, because you have to attend school being vaccinated, some parents who have opted out of vaccination end up playing catch up. And so letting them know that, all right, if you do not get these vaccines by this time when your child starts, you'll be getting more vaccines in shorter amount of time. So, that's also, that's helped us, at least in New York, a lot of the providers here.
I do not envy my the providers here. I have no words on that. I have to fight with people about why cupcakes shouldn't be in schools. So,
And that's probably getting easier because of food allergies. A lot of schools don't let you have food in the class.
oh, you know what? Georgia is like open territory. I've never seen a place like this before. My son actually had his first ice cream cone at 11 o'clock at school, in elementary school.
Wow.
It's just not here.
Georgia is a different state. Well, thank you all so much for joining us this evening. This has been the Kids Healthy Summit for 2022 for blackdoctor.org. And I hope that you've taken away some notes, and you've got getting together your health team for your child. You've understand the importance of vision. The eye doctor, you understand the importance of the dentist, you understand the importance of immunizations and vaccinations, and your children will have an amazing, safe, healthy school year. Thank you, everyone. Good night.
Good night. Thank you for the invitation.